Dr. Alex Sweet here. I want to share with you today how I'm bringing cutting-edge technology into the operating room to make things better and safer for my patients, as well as to streamline the surgical process for myself. So I have here the Vision Pro goggles by Apple, and I want to show you how I'm using this for augmented reality in the operating room. Because when I put these glasses on, the surgical world for me completely changes. I want to share with everyone why I'm so excited about this technology, because when I put these Vision Pro goggles on, I'm able to see things in an augmented reality, okay? The difference between augmented reality and virtual reality is this. So we're here in the OR. This is really here. This is virtual reality, right? We're not actually on the moon, right? So that's virtual. Augmented reality means I'm able to take things from the digital world and bring them into the room to make them look real, like some of these screens we're gonna see here. So this is Corey. This is the robot. This is the robot's camera right here and right here, so it can see everything. This is one of the screens. There's actually a second screen on the back, so if you're on the back side, you can see it. And this is normally the screen I utilize during surgery. I have to move it close enough because although it's not tiny, it's not that big. So in order to be able to see the fine detail, we have to move it a little bit closer. And this is my computer, which is interfaced with the Corey, and that my computer speaks to my Vision Pro goggles and allows me to pull in data. So why I'm so excited about this is the power to bring information to the tips of my fingers. So if I'm sitting here and my patient's laying here, and this is where the head is, this is where the feet are, so I'd be standing over here for a right knee surgery or right leg surgery, I can have all this information at the tip of my fingers. I can have, an assessment and plan. I can have their medical history up here if I want. I can have a radiology report up here if I want. I can have their x-rays. So if I'm curious about something, I can bring the x-ray in and make it look really big and really look at the fine detail. This is a valgus knee that's worn out on the outside. It's a knock knee deformity. I can make it small and move it out of the way when I no longer need it. I can look at the lateral image, right? And I can pull that in and look at the fine detail of this. If I need to make it bigger, I can. So there's a lot of power with this. And not only just with simple x-rays, but if someone's got an MRI, I can actually look at your MRI and look at everything in fine detail. So there's no limit to what I'm able to bring into this world. If there's a digital copy of it, I can bring it in here and it's really cool. But the most impressive thing about this whole thing is this. So we looked at our Corey screen, right? This is what I normally utilize for surgery. And if we were doing surgery over here, the machine would be here and I'd have to look at that screen. But with this, I can move this screen wherever I want. So instead of having to look back or look over here to see the screen, now I can operate right here in the screens right here. And not just right here, but when I need it, I can make the screen really big and I can see all the fine detail. And so this is augmented reality because these images, these interactive images augment what I perceive to be reality, but no one else in the room can see any of this. They can see me, they can see my goggles, but they cannot see this. You can see this when you watch the video, but that's it. And if this is getting in the way, I can make it smaller. I can even move it up on the ceiling if I really want to get it out of the way. And then there's nothing in the way between me and you. And I can always bring it back in. So the power to be able to have this technology at your fingertips during the surgery is incredible, because I can be looking at the detail of your knee here and the detail on the screen here, and there's really, it can't be any easier for me to maintain the workflow. So I really like how I'm able to do the surgery with this augmented reality. It makes things safer, it makes things more streamlined, and it's given me the power to show my patients what I'm doing in the surgery and why robotic technology is so much more accurate than conventional knee replacement. So thank you for being with me today. So this is typically what we find when we're outside of an operating room. There's a scrub sink for sterile surgical members to clean their hands and get sterilized. There's masks for us to utilize, and then we have the door. So we try to open this door as few times as possible during surgery. You'll see here there's bins like this all around. This is for
biohazard materials and sharps like needles. When we come in, there's the kind of nurses area right here that has a few computers for the nurse to chart or to look up things during the surgery. There's a bin over here, and this has a lot of individually packaged things we may need during surgery. Sometimes it's as simple as an extra pair of gloves or a suture needle, but other times it's just one-off items we may need during surgery that we didn't think we would need, or that became contaminated and we need another one. In the corner, you'll see this board right here. This board is where we write the patient's name and we do a surgical count. So any Ratex or laps, which are surgical sponges that get opened, blades or knives, needles, anything like that. We put allergies the patient has on this board. That way we keep track of everything that gets opened and utilized during surgery, so we make sure never to leave anything inside of the patient. As we come around, this is a computer screen that we can utilize, although sometimes we have a hard time interfacing. And you'll see tables like this throughout the operating room. These tables get sterile coverings placed over top of them during the surgery, and then we can open the sterile instruments on top of that. So these are designed to be utilized during surgery. Over here, this is a Bovie cauterization machine. So during the surgery, we have to have a way of stopping bleeding, and this uses electricity to help cauterize or stop the bleeding. Essentially, it burns the bleeding vessels in a controlled manner. This is a suction device. So when we use irrigation in surgery, we have to have a way of getting that fluid out, and so this machine gives us suction power. This is the tourniquet. All right, so this allows us to get a dry surgical field. So it squeezes, for knee replacement, it squeezes on the thigh and prevents blood flow so that we can have a dry field and you don't lose blood. This is the surgical bed. So this is what you will wheel into the OR, and then you will be transferred onto this bed. And we usually put a few straps like this on, and it's not to make you feel confined, it's just to hold you during the surgery and make sure no one has a fall or an accident, because that's not something we want to take lightly. And then back here, this is the anesthesia equipment. So that's the anesthesia machine. They have several computers to be able to chart on, and then they have this cart over here with a bunch of supplies. Anesthesia supplies, they're all very, very serious and high-powered medicine, so these cabinets are always locked for safety. This machine has a bunch of gases in it and medicines in it that help keep you safe during the surgery. So the anesthesia provider can put the advanced airway, the breathing tube down, and be able to keep you breathing and keep you oxygenated and safe throughout the surgery. It allows him or her to monitor your heart rate, your breathing, and all of your vital signs. So as we come around, this is actually a door that leads into a central processing area, and that's where there's some more sterile equipment. So if we don't have something in those cabinets in the corner, we can leave the OR without having to go in the main door, and it's cleaner back in there, so less chance of contaminated air coming into the OR and causing infections. This is a X-ray light box, which really hasn't been utilized since the early 2000s. These have gone out of favor for digital X-rays at this point. Again, you'll see more silver tables and things to have sterile instruments opened up on. We always have access to gloves, and then there's even a temperature control. There's a thermostat, right? And it's not just for our comfort or the patient's comfort, but it's also for safety. We have to monitor the humidity during the surgery. We have to monitor the humidity during the surgery. We have to monitor the temperature, because if these things rise too much, you can actually get condensation on the sterile field. So that's something, it's a safety mechanism that has alarms on it if it even gets close to approaching too high of a number. So that's the OR. I hope you enjoyed this walkthrough and look forward to seeing you here soon.